Good morning, everyone, and welcome to the webinar. April 12th already. The weather is just fabulous here in Cincinnati, just fabulous. Trees are budding, everything's great, and on the line with me is my colleague Shondell Coleman
Yeah. Grand
with
Rising. Hello,
Ambetter,
everyone.
and Tim is not here today. He's feeling ill, so Shondell is pinch hitting for him, and Shondell is our new account exec for Ohio. And let's just get through the slides. Okay.
All right.
All right.
Perfect.
So I'll go through my deck and then we'll toss it to you, Shondell. And
Perfect.
if you have a question, put it in the chat box to the right. We'll get to those at the end of the presentation. And here's my information. Take a moment, jot down my phone number, email address, and Eric Pouncey also works in the same role. We're part of the dynamic duo for the individual market here in Ohio. We're the largest wholesaler in Ohio, and we're celebrating 8 years as one of Cincinnati's best places to work. So a couple of pats on the back for us. And just connect with us when you get a chance if you have any questions about anything related to the individual group market. And then earn more when you sell more. For all new group and individual new sales between January 1st of 2023 and December 31st of 2023, you'll earn points that'll bring you closer to a $7,000 cash prize. And register today for that cash prize. I do want to emphasize the Health Sherpa enrollment platform, and in fact, this is what Ambetter uses as well. So this is the leading edge technology, and it's an innovative health technology that's the country's largest ACA enrollment platform with Health Sherpa's faster and easier alternative to the healthcare.gov. You'll have leading edge technology, and you'll need it to maximize your marketplace experience. Health Sherpa is the only agent platform approved by CMS, that's the government, to offer enhanced direct enrollment. You can access this at crnstone.com/health Sherpa. It's free. It's really cool. Check it out if you haven't done so already. And I'm going to toss things to Shondell Coleman. And if you're wondering, where's Anton? Well, Anton is doing other things these days. He has entered a new chapter in his life journey. He's, I believe, he's on his own. Is that correct, Shondell?
Yeah, yeah. As far as I know, he went to work with another organization.
Okay.
To do, yeah, pretty much doing kind of the same work, but
Okay.
yeah.
Fantastic. Well, happy trails to Anton, and Shondell is our new rep, and he's going to do a great job for all of us. He's fantastic. He's been a rep with Ambetter since 2017, and he does a phenomenal job. We're going to be in good shoes with Shondell.
Yeah,
And
absolutely.
with that, I am going to toss it over to you, and he's going to roll through his slides. This is part one of part two, and we'll do this again next week, and maybe Tim will be joining us if he's feeling better. So take it away, Shondell.
All right. Let me see. Can you see screen is okay? Everything's
I
still
can see
good?
your screen, Shondell. Thank you.
All right, great Grand Rising, everyone. Jeff, thank you. I want to appreciate everyone joining this call here. As Jeff had told you, I've been with Ambetter since 2017. Anton came on board a year later, so I hope to fit the same shoes or even above than what Anton as you all rep. So if any questions, anything, let me know. I'm here to help you all and be the best rep as I can be. Let's grow together and go from there, right? So this is Ambetter from Buckeye Health Plan for Ohio. As you know, we are in various states out there, but we're just going to focus on Ohio. And if there's any questions either later down the line or so, do let me know. So I'll proceed in going and moving forward here. I want to give everybody Ambetter big picture. Now, this deck I have is sort of some of the deck that we used in the past or before open enrollment actually started. So I'm leveraging some of that information. But just to give folks out there an overview of Ambetter, for those that don't know, I want to give you all some insight. Ambetter was established in 2013. Some of y'all may know that Ambetter used to be called Celtic back in the day. We are available in about 28 states across the country and still growing. We are offered by Centene Corporation and state health plans. We are on the Fortune 26 company with over 30 years in the managed care industry. And to change that is actually 3 million members. So we're very happy about that. Every year we continue to grow, better our network or price or plans, whatever that is. We are the #1 marketplace carrier nationally. And 1 in 7 shoppers choose the Ambetter, at the end of the day. We are certified on the health plan insurer, and our plans are designed to provide the best health care for our members out there. So just continue on the big picture. Those enhanced tax credit is going to continue on from the American Rescue Plan Act. As we know, we do have a $0 copay for teledoc virtual urgent care visits, including mental and behavioral health. There are almost none of our plans. There is a $0 after deductible for some of our plans, including the HSA plans. We have introduced the CMS standardized plans for the 2023, and we're continuing to expand, right? So we have the virtual access plan that's been added to 9 additional states. And then our Ambetter core, which is like the bronze, silver, gold, we have welcomed our new state, which is Alabama. So make sure that you're contracted there. And then Ambetter Select, that we have added that into 2 additional states, which are just Tennessee and Arizona. And not to name them off, but these are off-exchange plans that will be offered in these states only. So just keep that in the back of your mind there. And then we have expanded into Ashland County for Ohio. So that's the new county we have added. Now, Ambetter and brokers, we appreciate you all partnership and growth. We would not be where we are now without you all hard work and efforts. So we do provide a competitive commission on both our new and renewal members. We have a great broker portal that has keeps you in track of all your membership, commissions, and any different other resources that we'll get to later on. And then we have a dedicated broker sales and support team for you. So either they can be reached at via phone or we have email that you can reach out to Ambetter support. So the big map here, as you see, there's Ohio, and then as I told you all, we are going to have expanded into Ashland County. Again, continuing to grow. I'm not sure if we'll expand to more counties. They tend to do it every year. It just depends on the opportunity and market share, etc. But Ashland County has been added. So going a little bit dive deep into the 2023 feature plan. It has changed up, as you know, the product name used to be called a secure, balanced, and essential. Now it's called these different names on the side here on the right. So those marketplace product name has changed. So if you have any issues or need to know what plan your member is on, just reach out to me. I am the account rep. I can make sure I can answer any questions for you all, or even our broker support team. But yeah, so from the bronze, the Essential Care 1 is now called the Clear Bronze. We have the Essential Care 2 HSA, which is now called the Choice Bronze HSA. The Essential Care 5 is called the Everyday Bronze, and the Essential Care $0 medical deductible is now called the Elite Bronze. For Silver, we have our Balance Care 4, 11, 12, 28, 30, and 32. Those have been converted over to the Premier, Complete, Everyday, Elite, Clear, and Focus Silver plan. And then the Gold, we have the Secure Care 5. It's now called Complete Gold plan. And then the Secure Care 20 is called the Everyday Gold. And I do want to let everybody know, if you go to ambetterhealth.com, you will find, all the plan designs and information there on our website. So we have changed our off-exchange product names for 2023 as well. For Silver, we had our Balance Care 201 HSA, which is now called the Silver 201 HSA. We had the Balance Care 203, which is now called the Silver 203. And then for the gold plans, we have the Secure Care 201 HSA is now called the Gold 201 HSA, and then Secure Care 202, which has been converted to Gold 202. Okay. So this is just renewal letters. This has passed already. So the members, we do advise let members know they do get those renewal letters. They do get their new ID cards, which has been sent out to them. And then if any members that hasn't done anything, nothing changed within a circumstance, it's just going to roll over into the same plan unless there has been a change. But we'll still notify the members of that. So yeah, just again letting you all know for those renewals come in, there's no changes. You don't have to do anything. We simply just let that roll over. I do advise brokers though, just to check your members in case anything changes within their income or certain circumstances. If not, then again that's just going to roll over. Any changes you can do that from their member portal account. Just FYI. All right. So
Hey,
let me get that.
Shondell, I had a
Yep.
question. I just
Yep.
want to jump in here real
Yep.
quick. The agents brought up a really good question. Can agents get these renewal letters sent to them also?
Good question. We don't send letters to brokers. They only go out to the members. I don't know why or the logistics behind that, but usually for those letters, we give them just to the members. We do, let the brokers know, to follow up with your member or if we're sending anything out. But yeah, we don't give any copies out,
Okay.
unfortunately. Hopefully they change that though, in the future. But
Yeah,
we'll see.
if I'm not mistaken, a lot of the client information is available out on that really good, broker portal, right?
Yeah, absolutely.
So,
And I think it'll be a good idea to even add that too. So I'll make note of that actually. Get a good point. Like for the portal, it'd be nice if once the renewals come, if we can get a copy of it in our portal. So I definitely
that's,
pass it along to the higher
yeah.
team. Yeah, if there's anything you all want to see or changes
Mhm.
or something, let me know, and I'm gonna pass it up to the to our leadership team. Because we always want to know what can we change and I know some of the things be within the portal itself. It's so much stuff you can just have right within that system. So, but yeah, I'll pass that along. Anything else come up, definitely let me know. I'll pass it along. Was there any
Great.
other questions, Jeff?
No, but it sounds great. You're coming
Okay.
through loud and
Yeah.
clear, so all is good.
Yeah,
All right,
great.
thank you.
All right. Right on. Okay. So all our Ambetter plans do include the comprehensive major medical coverage. So a variety of emergency services, pregnancy, mental health, prescription drugs, lab, and et cetera, and other things. And then in addition to that, we do have our My Health Pay rewards. It's definitely a great program out there for members who can earn up to about $500 of free money just doing different activities, and I'll get into that a little bit. Our medical management programs, and then I did mention this, our $0 copay for our virtual urgent care visits, including the mental and behavioral health for most of the plans. No exclusions for pre-existing conditions, and a local health plan staff we have. So, every state we do have a health plan rep, or head of that. So if I have like a issue, I can go strictly to the Ohio State Health Plan. So we do have a good staff that supports us. So the Ambetter portfolio overview, it has the bronze, silver, gold core portfolio. This features our Ambetter's broadest provider network. Okay. So formerly referred to essential, balanced, and secure plans. Now it's called the bronze, silver, and gold. Members can visit any in-network provider. No referrals are needed. So if your member goes to Florida or Indiana or something, as long as that provider is in network. Okay. We have adult vision and adult dental by-ups available on most of our plans and available in all Ambetter counties. All right, so moving forward with the Ambetter Virtual Access Portfolio, they got the name as Babyline Platform. There's no referral requirements for this. It is virtual. This plan is designed for members who desire a virtual primary care experience. So that member would download the Babyline app, and they're going to select that Babyline PCP. So the plan is not designed for members who want a traditional brick and mortar PCP, but it does have a limited $0 visit with this, and then the cost sharing will apply to visits with the non-Babylon PCP. There's no referrals not required from their Babylon PCP. to see providers outside of their baby law PCP, including those specialists. With this virtual access portfolio, there's a 24/7 virtual urgent care, and then the mental behavior health appointments at $0 cost to members. Your member will have access to $0 lab testing at some of our preferred labs, and then there's no vision or dental buy-up offer on that, so do keep that in mind in case members want to know. And then medication can be prescribed and sent to a local pharmacy after the virtual visit. So just in case your member out there wants something virtual compared to a core plan, I do want to point out a difference here with the network, right? So if your member want to go in person across state lines and stuff, just make sure they're on the core network plan. Okay, this is the virtual access, so just point it out. So this is the overview. This is the 2023 Ohio Gold, Silver, Bronze portfolio out there. We have our gold, complete gold, everyday gold, and the clear gold. And then we have this features Ambetter's broader provider network. All of our plans do have optional vision and dental offerings, excluding the CMS standard plan. Okay, and then the lowest premium bronze, we have the clear bronze. The lowest premium silver, we have the clear silver. Lowest premium gold is the everyday gold, and the lowest copay plan is the focus silver. And then our new plans that we have introduced is the clear gold and enhanced silver. Now I know it's a lot of plans out there, and with the name changing and everything, but try to keep things so everyone can understand and not have any confusion with that. So just want everybody to look at that. And again, this is all on our website, ambetterhealth.com. If you need me to show you all anything or where to go, I'm here to help. All right, for the virtual access portfolio, there's the gold Ambetter virtual access gold. There's the silver Ambetter virtual access silver, and then there's the bronze Ambetter virtual access bronze. These are all new to 2023. These are all members that want to experience that virtual primary care. A virtual PCP selection is required for this. And then just make sure that these portfolio plans do not have vision and dental offerings on them. There is a $0 copay for a limited virtual PCP visit, as well as any lab testing on any virtual access portfolio plan. All right, so I'm gonna dive deep just a little bit into the plans. I'm not gonna go too much here. I'm just gonna focus on the AV level as well as other stuff. But this complete silver plan is formerly known as Silver 11. This is the lowest premium of any silver plan offer. It has a $0 deductible at the 87% and 94 percentile. Okay, so this goes as low as up at $6,000 for the base. Goes as low as $0, or as low as for the 94% AV. Max out of pocket is $8,500. It goes as low as $1,700. The co-insurance start at 40%, go as low as 25%. And then there's no charge. As I said, telehealth is all $0. And then we have our PCP visits start at $30, go as low as $0. Specialist visits at $60. Lab at $30. We have a preferred generic start at $5 across respectively, then $0. And then our preferred RX start at $55. Urgent care, $60. Goes as low as $10 under the 94 percentile. So just really based off, just where your member lies at, based on their income, etc. This here is the Focus Silver. This is formerly known as the Silver 32 plan. This is our lowest cost silver plan that includes copays for PCP, specialist, lab, urgent care, and generic RX. Okay, so this starts out at $6,100 at the base, goes as low as $0. And then the max out of pocket start at $7,500, goes as low as $1,200 across the board. And then the co-insurance 50%. Telehealth, there's no charge. We have our PCP visit for the base is $45, specialist as $100, and then our lab at $50. Preferred generic drugs are $5, and then preferred $75 starting off. Then our urgent care $60 goes as low as $10 for 94% now. Enhanced Silver, this is a new plan for 2023. This plan has co-pays throughout the plan. It's $0 deductible at the 87% and 94 percentile. This start at $38.50 for the base, goes as low as $0. There's a max out of pocket start at $8,600, co-insurance at 40%, and then there's no charge for telehealth. PCP visit for this plan is $35, goes as low as $0. Specialist visit 65, lab 40, preferred generic drugs are $5, 87.94% is about $0. We have a preferred RX, $65 after the deductible, and goes as low as $50 after deductible. Then urgent care $60, goes as low as $50, respectively. So I know there's some plans out there. I just wanted to point out some of the lowest kind of plans out there and premium plans. That's why we kind of going through this. The Clear Bronze, this is formerly known as the Essential Care 1 plan. This is the lowest premium bronze plan out there. It does have a matching deductible and a max out of pocket of at $8,600. 0% co-insurance. There is a 0% after deductible for the PCP visits. Telehealth no charge. Specialists and the lab are 0% after deductible. We have our preferred at $5, $25 respectively, and preferred RX is 0% after deductible. Urgent care $50, virtual $0 for this plan. Okay. The Clear Gold. So this is a new gold plan. This has the lowest cost premium gold plan on the core portfolio. This does features co-pays for generic medications and urgent care. This has a $900 deductible, max out of pocket of $8,700, and then the co-insurance is 30%. We have our $25 co-pay for PCP visits, $60 for specialist visits, 30% for lab work, any preferred and generic $5 and $15 co-pay, and then our urgent care $60, virtual is a $0 copay. All right, so diving in deep, this is the Ambetter Virtual Access Silver Plan, all virtual. So this is designed for members, obviously, that want that virtual experience. This has a $0 virtual PCP, spec, and urgent care, and then the labs are $0. So this starts at $5,700 for the base, goes as low as $100 for the deductible. There's a max out of pocket that goes as low as $850 for the 94%. And then our co-insurance is 50% across the board, no charge for telehealth services. PCP visits, $0 across. It's for the virtual, the BMM that I did mention in the other slide. There is a price for that. But if it's more so just virtual, then, your members can expect $0. The lab, $0, preferred, it varies $5. And then we have our urgent care at $0 across the board. All right, so this is the Ambetter Virtual Bronze Plan. This does have a $7,000 deductible. Max out of pocket is $8,550 with a co-insurance of 50%. We have a $0 telehealth for this as well for the PCP visit, specialist, lab. Generic is $5 low. We have a preferred RX $160 after the deductible, and urgent care is $0 virtual. All right, so this is the gold plan. This is a $950 deductible, max out of pocket at $8,700. This goes as low as 25% for the co-insurance. The telehealth, PCP visits, specialists, and lab are all $0 for virtual. And then we have our preferred generic $5, $15 for generic RX, preferred RX $50, and urgent care at $0 for this plan. All right, so I'm going to talk about the adult vision add-on. This information here is not out there in the marketplace or whatever. So if you need like a breakdown of this, just come to me, and I can make sure you have this information or broker support. Doesn't matter, but I don't think they put this out there. But for adult vision add-on, this is 19 years of age or older. So with this, your member is going to get a routine eye exam of 1 visit per year. I think the screen just stuck on me. There we go. Routine eye exam, 1 visit per year, $0 copay for all in-network. Eyeglasses frame cover up to $130, and then the contact lenses are covered up to $130. All right, so moving with the adult dental. add-on. This where your member can get $1,000 per covered person per calendar year. And then for our class, we only have the $0 copay for the oral exam cleaning and bits of things. And then you have the basic dental, which is more minor work. There is a 50% co-insurance for in-network. And then we have more of the major dental work that's also 50% co-insurance. There's no waiting periods on this. Again, if you need a breakdown of this information, they do put this in your broker portal, and I can show you where to find this, or just follow up with me. Make sure you get that. Off exchange plans. This idea for consumers who don't qualify for subsidies. It's affordable premiums and same provider network as well as the formulary. And then you can enroll your members through the EDE, which is powered by Health Sherpa. If you do have your own account, that's fine, or you can use through us because we do use Health Sherpa. But here, these are off exchange plans, plan level, and now called the 2023 product name, the Silver 201 HSA, Silver 203. And then for the Gold, that's the Gold 201 HSA and the Gold 202 for off exchange. Now, price difference, you may see maybe a little cheaper, not really that much, but off exchange plans could be quite affordable for some members out there. And also, let me see here, some of the plans for off exchange feature the low deductibles, primary care and specialist copays, and those copays for the generic medication. And then many of our plans do have the optional adult vision and adult dental buy-up. So here we get a little bit more deep into, letting you all know how to find a provider, how to utilize the formulary, the My Health page that I mentioned, that program where members can earn $500 free money, and the telehealth, which is the $0. So how do I find a provider, right? So I'm going to show you all first. I think it's the member portal. Your member can log in, and they can create an account. I do advise members to log in, create an account. That way can get access to the My Health page and doing those various things in there. So they're pretty much log in. I know some people out there are not tech savvy or so, but your member will log in. This is just the overview of how their portal will look. So hi, Joseph. So you got all these things up here: doctors, pharmacy, payments, rewards, usage, and the coverage at the top. Everybody should save this. This is where the link to finding a provider, guide.ambetterhealth.com. So anytime you need to look for a provider, you can use this link. I know some people go to Marketplace or other things, other places. I do advise just going strictly through our site to see if that provider is in network or not. So you can log in. If you don't log in, you'll have to have, or you don't have a plan. You can click don't have a plan. And you'll pretty much select the state, the coverage year, and the county. And make sure you select the network. Either your members like on the virtual, the core, which is the bronze, silver, gold, you will select that. And then some of these are different because we have Florida, for example, they have like value plans, select plans. It's a bit different. Ohio is different. So that's why you see different things out there based on the network. So this is the provider guide here. So just make sure you have the right information here so you can get the most accurate result. So here's just Florida. You put the year. You make sure the right network is selected, right? And then you'll get a whole list of those providers that pull up here on the left. Okay, so you'll get the name. You'll get where they're located. You'll get their stuff in any new patients, and where they offer any virtual visits for the member, and then you can view the profile. It'll give you more information on that provider itself. It'll let you know what their NPI is, which I think is very important, dealing with authorizations and getting that communication between the provider and the carrier. All right, I'm going to move forward here. So in case you are looking for the 2023 formulary, you're going to go to ambetterhealth.com. Just make sure you're on the Buckeye Health Plan. You'll click drug coverage. And then this is just the deck showing. It's not even showing 23, but it is up there. You will click on the 2023 preferred drug list. Now it is a big file, so I recommend you click Control F. Control F is the best way to do so, and you're going to put the medication in there, and it should give you, see if that's coming up or not on that formulary. If it's not, then it's not covered. If it kind of any exceptions or so, you do have to go through our member services team for that. But just FYI. So back at the portal here, the member portal, if your member needs to click on any pharmacies or they're looking at any drug lookups or so, they can just quickly go to the pharmacies. Now, if they go to payments, they need to make a payment or anything, they can simply go and click make a payment. Now, if you also go to ambetterhealth.com, you can also make a payment there as well for the member or as the broker, you can go ahead and do that. Just make sure you have these three information here, policy number, the date of birth, and the zip code. So just keep in mind that the policy is not active until the first month's premium is received. So just make sure you know your member. Yep, I heard.
I just want to jump in real quick. One of the agents asking, could you go back to the provider lookup website? The
provider lookup website.
Mm-hmm.
Yes. In case you need to look up any providers, I do advise agents to go through that link, guide.ambetterhealth.com. That's the question, right, Jeff? You just asked.
Can you navigate back to that? Maybe go back to that slide.
Yeah, absolutely. Go back to that. Sorry. Make sure everybody gets that.
Okay. All right.
Almost there. There we go.
Guide.ambetter.health or guide.ambetterhealth.com.
Yep. So just make sure save it for reference. It is a quick, easy way to just let me just go here and see if this provider is in network. We do have a process in case we have providers out there, right, that say, hey, this person is not taking Ambetter, but they're showing on the site,
Mm-hmm.
So there is a process out there in case you need to report those issues. Jeff, I could pass that along to you and the team in case they have issues with a provider. So if in case that happens, there's a process they have where you can go through the actual provider guide and you can report that. I can send that to you, Jeff, and everything on how to do that. But any questions or issues, just let me know. But I'm just letting everyone know out there, in case that happens, what do I do? So there's a process for that. You can come to me if there's a big issue like, hey, or broker support, can get in contact and anything like that. Just let me know, and I can get to the bottom of it for you all. So,
okay, and then just add to that on the drug topic. How can we get?
Drugs.
Yeah, we're talking about drugs again. How can we get exceptions for drugs that are prescribed in a network? Network.
Yeah, so you will have to go through customer services for that. I'm not sure of the process, how long or logistics, but if there's any exception you need to make, we do cover pre-existing, but you do have to go to customer service see that's something cover for that member. We don't really deal with everything. We just tell them, hey, you gotta go customer services. But yeah, that's what you'll want to do in case you come across that.
Okay. Or you can reach out to us. And
we'll
point you in the right direction.
Let me go forward here. Just bear with me. Sorry, I just want to make sure everybody has all the information they need. We just talk about the medication, the pharmacy, the payment. Perfect. All right. So just ways that you're. I'm sorry, Jeff. Was there anything else out there? Sorry, I didn't want to.
No, I'm sorry. I just wanted to jump in.
Okay.
We got past it.
Anytime. So different ways your member can pay. I know some brokers like that, will pay on behalf. You can just go through the website. From the member portal, though, your member can make a phone call, just call customer services. They can send in a via mail, or they can do a MoneyGram into sending that. Now, if they want to pay like the whole year, or so, they can do that as well, just in case a member want to pay the full year. For the payment settings, in case your member want to enroll in auto pay, they can do so. They can manage their wallet, they can enroll in paperless, and they can download invoices. So this is post application. So after enrollment, your members can expect a pre-member letter, just reminding them to make their payment. If that payment wasn't collected at the time of enrollment. Once that payment is received, your member will receive an ID card and a welcome packet in about 7 days. Now, once you enroll a member, it can take 24, 48 hours for that enrollment file to come over to us. You can see that in your portal as well, what that policy number is. But in case you need to know what that is, it's not in your portal, you can let me know and I can get that information for you. Any returning members, they can continue to log into their member portal and complete any onboarding surveys. And then for any new members, just make sure they create an account on that member portal site. Now, these ID cards, they are different compared to in the past. They are now this color, different colors. So I see how they broke it down to based on the network, if it's a value, virtual access, or select, and then with the codes and things like that. So, but yeah, just to let you all know, it has changed how the new ID cards look. You can from your member broker portal. From your broker portal, in case your member needs an ID card, you can print an ID card from there, okay, or send it to them. So rewards, kind of want to talk about this, the My Health Pay rewards. I really like this because when I had started off, I participated in My Health Pay rewards program. It's a way for your members to do different activities so they can earn rewards for completing, just those activities and get that free money, right? So they complete those activities to earn points, watch videos, articles, any challenges out there and more. And then they can redeem those points so they can save, anything in the bills or so. Now, again, the members can save about $41 off their premium and then, get about $500 free money just by doing different stuff. And that's why I said $500 free money. So they own these points by completing different screenings and surveys. Again, they have to go through their member portal. Some of those rewards include the survey, the exam, the screenings, and different quality measures that they can participate in. And then this is just a way for members to, focus on their health, right? We all want to look good, feel good, and also, how I like it is that $500 just by doing, different activities. And you use those points to shop on online reward store, which is very dope. And then you convert those points into dollars to pay, your premium or any other healthcare related costs. You get this nice raspberry color too. Each member can definitely get this card, not just like one member. So some of those things your members can use it for: premium, doctor copays, deductibles, co-insurance, and then we all got bills, right? So we can use that free money to pay some of those bills out there: utility, transportation, rent, etc. So just keep that in mind to tell every member, like Ambetter has this program, My Health Pay, where you can get $500 for free. So these are just some of the activities in those states that your member can do, from onboarding to wellness, and then what those rewards can be used for. So definitely a good program out there and has been. And myself, I had utilized it and happy to get that free, buddy. So with the My Health Pays year to date, I'm pretty sure it's a little bit more than that, but nearly 300,000 Ambetter members have activated their My Health Pays account. And then collectively, those members earn over $24 million in rewards. And then those who activate My Health Pays are likely to renew with us. Now, this is Advinity, which is a different program with, you can go like gym equipment if you like to work out. This is a separate site that you can go to in the future. If a member is asking, I do have information on the site where you can go to for that. But your member can get discounts through Advinity. So good thing to point that out there for members. All right, telehealth. So this last telehealth is the one we mentioned in the past. It has a $0 copay. So this is the homepage site there with the telehealth with Teledoc. There is a 24-hour help for non-emergency issues. We connect your members with the top experts regardless of their location. And we hate those long wait times because it does cut off time and reduce the cost when the member's PCP or clinic is not available at that time. It's very good for those rural areas out there. And again, it's a $0 copay for virtual urgent care visits, including mental and behavioral health in most of those plans. Point that out, $0 after deductible for some of those plans, including the HSA plan. Disease management, just one of those programs out there for your member. They help them keep track of their health and wellness. In case there are any major issues, diabetes or so, we do have this program out there to help them keep track. There you go. So they'll be able to check with any care managers out there with using disease management to track their progress, in case they have any diabetes out there or blood pressure, and you get alerts and reminders throughout the app. So just throwing that out there as one of the tools out there we have for members in case they have experiencing any multiple issues in the area. All right, so the broker portal, this is the broker portal. So once you get appointed with us, this is where you keep track of all your book of business and your policies. So any issues with your broker portal, IT issues, or missing members, you can follow up with me, or you can reach out to broker support. But I'm here for you all. I know with some things I may have to go to broker support because they have the resource to go to this person or IT to fix anything. So just save that, broker.ambetterhealth.com. That is the URL for your broker portal. Okay. Broker sales support. This is our broker sales support team. This is their phone number and the option to select. But this is the main page for your portal. So when you go to broker.ambetterhealth.com, you will go by, create an account or just log into your account. And this is the dashboard of your broker portal. So here you'll see a pretty nice dashboard. You'll see, in case you want to enroll a client now, you can simply go and click that. Again, we do use Health Sherpa, and then you can find a provider from your broker portal as well. If you need to make a quick payment for your member, you can also do that. And then here at the bottom, you have the total active members. You have those delinquent, those who are 30, 60, or 90 days, 120 days late on their policy or premium. And then you have the unpaid binder payment for those new or renewal members there. So when you click on policies, you see for those who are active and paid to date on their policies. And here on the right, you can be able to download the file to Excel if you like. It's a better way to just, see what particular members are behind or up to date, paid through, etc. But you can simply download that and make an Excel spreadsheet. Now, policy number, if you click on policy number, you're taken to that member's policy. Okay, so you get this dashboard here. You'll see the ID cards, the invoices, and then some of the plan details, their premium, APTC, and their responsibility. And then I did mention if you want to order ID cards, you can simply click that. Just keep in mind that will be mailed within 7 to 10 business days. If you go to delinquent, those that's just a little behind in their payment, you can see for those members who are delinquent, paid through date, their responsibility. On here, go back to the policy number, and then you can see the delinquent status. It'll show you there how delinquent they is on their payment. Information, contact information, quick pay, in case you need to make a quick pay for the member. Just do the same thing as you go to the regular website, policy number, last name, and the zip code, and they'll be able to track that member and give you a confirmation upon payment. Anybody that's unpaid, you'll see the paid due date to see what that member is at. And just go back to quick pay and make that payment. Resources, this is a very good tool here. If you go to resources, there is some nice information in there from marketing materials, training materials, and forms. There is a copy of this deck in the portal You just have to go to training materials from there. But it does have different various information from social media, getting promoting your stuff, or there's some marketing things. If you ever need some Ambetter swag, I like to call it, giveaways and stuff, just ask me, come to me, and I can tell you what we have on hand, and I can get that sent to you. Okay. So if you go to marketing materials, you go to marketing materials, training materials, and then again forms. Just spend a little time just navigating through that again. You'll find some valuable stuff in there. Even stuff that we send via email to you all. I know you all be so busy and with overload email. So you can also go here if you want to go to your profile and you just want to see where you stand. With your appointment and everything with us. There's any issues or so, let me know. But you can't go here just to, keep track of where you are with your licensing, etc. Okay. And if we need to delegate any access, more so for our principals out there, bigger agencies, we can delegate access to who, need access to the portal. So we are coming in for the long stretch here. These are just top reasons to sell Ambetter. We're very proud and want to just share this again. Centene ranked number 26 on Fortune 500. We are the number one ACA carrier, and we do cover 1 in 7 lives nationally. We have had our products in Ohio since 2017 and continuing to expand. We do offer off-exchange plans statewide. And then we have our enhanced teledoc program, which is $0 copay. The enhanced My Health page, which I think you earn up to $500 and reduce your monthly premium by $41. And then some of those value-added benefits for your member, Start Smart for your baby, 24/7 nurse line and care management program. You have your enhanced broker portal. You have a dedicated broker support team. And then you have the enhanced direct enrollment tool, which is provided free to you in case you want to enroll any members. And then what providers you need. So on the right, this is just some of the providers in network with us. From Cincinnati, Mercy Health Systems, and then from Cleveland, we have Added University Hospital Health Systems to our provider network in Cleveland. Columbus, Ohio State University was an addition for us, and then Toledo area. Again, this is just some of the networks out there. Again, you can use that link to find a provider to see who's in network with us as well. So here's the contact information. Just everybody want to have that for your record. Broker sales support on our left. They are there to support you in researching member inquiries, enrollment status, case dates, and ID card requests. Commissions, anything around commissions, EFT, broker web support tool. If you need password reset issues or educational broker web tools, any IT issues, they'll be there to assist. Find a provider, contracting follow up. There's their number 855-700-7985 option 2, and then their email is ambetterbrokers@centene.com. Then you have broker sales. Oh, I'm sorry.
Oh, perfect. Yeah. And we're not to jump in here, but we're going to be wrapping up real soon, and I just have a couple more questions.
Absolutely.
So, what does a doctor have to do to get in the telehealth list?
A doctor to get in network with us, to work with us,
Yes.
pretty much.
Mm-hmm.
So there is a process a doctor will have to do. I could show you on the website if you have, if you want, or have time, but they have to go through the website. You want me to show you, Jeff? What else?
Well, I believe it states it right here on the bottom left. The find a provider assistance, broker changes, contracting follow-up.
Yeah, that's in case if you have agents out there that need help finding a provider. Yeah, that's for agents. But in case of like doctors on the hand, they'll have to go through the website to to go through that. And like I said, if you need me to show you or anyone to show what doctors need to do in that area, I can show you what they need to do.
Okay, maybe in the follow-up email you can send we can send that contact information. I can send that to everybody. And
yeah, absolutely.
I know folks are we're running over a little bit, so I just wanted to get through these questions if we could,
Oh
and
yeah, yeah,
we'll have
yeah.
more
Sure, sure.
next week when we do.
Absolutely.
Um, and what about in Cincinnati, Christ and UC? I believe both of those hospitals are in network, right?
Yeah, we have those hospitals. They're in network.
Hmm.
Let me go back to the in case you all want to see that. Yeah, they just put some of those providers out there. It's not all the network. But again, if you need to check something or any issues with that, just let me know. Now, just keep in mind too, like we have a provider in network. Don't expect
Hmm.
all the doctors to be in network. We
Hmm.
might have just okay, you all have this provider, but why not
Hmm.
all the doctors there? But just keep that
Hmm.
in mind. It'd be particular doctors that may have
Hmm.
contracted
Yeah,
within that.
yeah. I know you guys have Christ and UC. Those are two primary hospitals in
Yeah,
Cincinnati.
yeah.
Uh,
Yeah.
does the, and then just kind of wrapping up here, a couple more questions, and then we'll call it a day, and we'll do it again next week. But I had a couple more questions. Does the Columbus network include the James Center, which is the world-renowned cancer center at Ohio State University, along with um, or a part of the OSU system? So um,
Hmm.
anecdotally, they do. I've seen that out there. It's just important that you
Mm-hmm.
go out on the provider finder and look at that and save it and
Absolutely.
save it to your CRM. So you'll have to go out to the website and look for the James Center and those affiliated providers. And then one last question.
Mm-hmm.
If you take the telehealth plan, can you see a specialist in person without a referral? It's a good question.
Yeah, that is a good question. Just make sure anything with telehealth you can do that without a referral. Ohio, so any member that is on telehealth, they can go ahead and see a doctor in person. Just make sure that obviously that doctor is in network with us, but they will be able to see that doctor without a referral on telehealth.
And that would include specialists?
Yep, any specialist. Mm-hmm.
Okay.
Oh, my
Um,
screen is out. Let's see.
okay. And again, we'll do this again next week. We'll have some more topics we'll discuss. And I really appreciate you jumping in here, Shondell, on short notice. Did a fantastic job.
Absolutely.
And,
Thank you.
we're just thrilled, all the new benefits that Ambetter has, they are knocking it out of the park. They are, one of the, if not the top products here in Ohio. And so glad you
Awesome.
could join us today. With that, everybody,
Yeah, that's great.
I'm going to start to wrap things up. Shondell, did you have any last thoughts? Did you want to maybe share your phone number and your email address?
Yeah, yeah. Let me go ahead and do that. I wanted. I know we was on time and everything. Let me know if you see my screen because I did have my
I do. Hmm.
my Oh, okay. Perfect. Perfect.
Yeah.
Okay. There we go. Go back. Go back. Come on. There we go. Yep. So this is our sales team for everyone out there. Tim Condon out there is our sales manager. They have his phone number there as well as his email. We have my colleague Kobe Banks and Patrick Tenner. They work with other brokers out there. They are on the Midwest team of mine. And then there's my information. So make sure you say my information. My phone number 312-619-3087 for Shondell Coleman. And then my email, shondell.d.coleman@centene.com. So
Outstanding.
in case y'all have any issues, make sure you save that information as well as broker support. And Jeff, I'll make sure you get that follow up, message with some information that you can share with your team. So,
Everybody will get a copy of the presentation, and we'll also post it out
uh,
on our
yes,
website. So this slide deck will be out there on our website in the resource center. And Shondell, I think you'll provide some additional information that I can share with the team. And
yes.
with that, everybody, have a great day.
Have a good one, everyone. Thanks, Jeff.
You bet.